Hi, everybody. This is Nishtha, Sareen. We are talking under the initiative Be For You, For Them. And we are going to be talking this month with Dr. Dana Bonaminio, who is the Director of Breast Imaging at Ascension Saint Thomas Center for Breast Imaging. She is a phenomenal radiologist who's been in practice for almost 10 years, a great person who also happens to be a good friend. And Dr. Bonaminio and we work together on some initiatives as well that she will touch upon. It is an absolute pleasure to have you today, Dr. Bonaminio. Please tell us a little bit about the screening mammograms, what we should know.
Thank you for that wonderful introduction. I'm happy to be here today and to provide some education on breast imaging and the impact to your health. So in general, screening mammography is one of the tools that we use to detect cancer early. That starts at 40 years of age for our average risk women. And if you've not had a mammogram, can be a little scary and intimidating, but it's very routine and it's usually in and out in 15 minutes. And essentially we use a X-rays to go ahead and image your breast tissue. And that allows the radiologist to detect subtle changes, or in fact, if you feel something, if you're something different to your breast tissue in your clinical breast exam, we see you for that as well. So screening is the opportunity to see you year over year and make sure that your breast tissue has not changed in any way that would concern the radiologist. And we can talk a little bit about what that looks like. And then the diagnostic mammograms are opportunities for us to see you if you have a clinical concern.
That's great info. And so when Dr. Bonaminio, when a patient gets the report, what are the red flags? What are the things we should look at and, perhaps be more aggressive about screening or asking questions?
That's a really important question. So when as your patient, it's always important to advocate for yourself. For radiologists, when we're looking at your imaging, we're looking at the imaging features that would tip us off that there's something happening in your breast tissue that's changing, that would then indicate that we need to do additional imaging, maybe additional mammographic images, sometimes ultrasound. Sometimes then that leads us to a biopsy of an area of your breast tissue that has some clinical concern or some imaging concern. For patients, it's really important what you need to do is, other than getting your routine imaging by your mammograms yearly, it's also to notice if anything changes in your tissue, right? So if your breast exam, you feel a firm lump, or you notice nipple discharge, or you have breast pain, those are important indicators clinically that maybe there's something happening in your tissue that needs a little more evaluation by your radiologist and potentially a breast surgeon or clinical team or your primary care doctor.
Excellent. And when we do a CT scan, and we are focused because we're doing CT scan for, say, a heart or a lung, but there are so many other things that are seen by our radiology colleagues, which are reported by some, which are not reported by some. What are those incidental findings on the mammogram that could be more important than we think they are?
So that is probably the reason why we're here today. So breast imaging, as a breast imager, oftentimes we're focused on looking for breast cancer. So we're trained to look for breast cancers. And again, the subtle changes that might indicate something's additionally needs additional workup. On top of those types of changes in your breast tissue, your mammogram also unlocks and gives us information about your heart health. So the mammogram itself, we call them microcalcifications. There's very small calcifications that happen in your breast tissue, nothing you could feel. So oftentimes they're just, if you can imagine, sort of little grains of salt in your breast tissue, and that's what we're looking for, these little subtle calcifications. So there are vasculature, so blood vessels in your breast, just like the rest of your body. And when we take an X-ray of your breast, we can see that some women have calcifications that are in their blood vessels in their breasts. And when we see that, especially in our women that are in an age range where you might not anticipate them having calcifications in the vasculature in their breast tissue, we wonder, and we importantly are engaging with our cardiology colleagues about understanding the potential risk that patient may have for having a cardiac event, or is it an opportunity to improve our screening not only for breast cancer, but also screening for heart health for our patients.
Very well said, Dr. Bonaminio. And there are data that when you see any amount of that calcification in the vasculature of the breast tissue, that is the artery in the breast tissue, it could predict worse outcomes in women compared to their counterparts who don't. And typically, it's 3 out of 10 women who get mammograms that it can be seen. But as Dr. Bonaminio mentioned, this is something we are still working on. We need to understand it better. We really need to generate awareness because a lot of radiologists don't report it. I know Dr. Bonaminio does because we do talk, and it's something we really need to improvise. Any final words of advice for the people who are listening to this from your standpoint for mammograms, Dr. Bonaminio?
Get your mammogram every year, starting at 40. Know your breast density. We didn't talk about that a lot, but it's an important part of your heart. It's an important part of your breast health, and that you may need additional supplemental screening additional to the mammogram. Okay. The other bit is, I mean, you can always ask your provider and say, did she comment or did he or she comment on my mammogram about my vascular calcifications in my breast tissue? Right. So those are important. Those are important markers for us and for you to know about your health. The other bit I would say just in general is know your risk. Understand the women before you who, if they've had, your family members, have they had breast cancer? Do you have any genetic predispositions to breast cancer? Ask questions. And those are the ways that you'll understand your family history, and that could indicate that you do need additional screening.
Thank you, Dr. Bonaminio. We appreciate your time today to talk to us. This was a great session. We will have more questions coming in, and I will direct those to you when we do. I thank you all for being here for this podcast for this month. If you have any questions, any suggestions for next month, please email us on beyourselfcontact@gmail.com. Otherwise, take care, stay safe, and see you next month. Thank you.
Thank you.